So I want to welcome you all that have come to this webinar to find out about University of Otago EMDR Therapy program. I wanted to acknowledge Tangata Whenua of this motu and also the founding originator of EMDR Therapy, Dr Francine Shapiro, the late Dr Francine Shapiro, for her incredible pioneering work and academic rigour that she's helped to develop this therapeutic technique and method and psychotherapy now. I also really want to acknowledge Dr Tom Fluitt, who was the pioneering person who set up this course in the University of Otago, and this is only the second university-based EMDR therapy program in the world. So Tom was actually the first EMDR therapy trainer that had been trained overseas to start training the rest of us here in New Zealand. And at that point, we could say goodbye to the Australians and bring on our own New Zealand trainers. So we now have about 4 New Zealand trainers. And he has now pioneered setting up this course at an academic sort of setting, university setting, so that we can ensure that there's competence, not just completion. Okay, so what I'm going to do now is just do a little intro on what is EMDR and then why choose University of Otago to do your EMDR training and what does that involve and who can register to do this training. And then hopefully we might have a bit of an insight from a past student at the University of Otago. So as you know, at the University of Otago, we have a Wellington building, which is right next to the hospital in Newtown. And at this building, we have something called the Psychological Medicine Department. So you can see that on my screen here. And this department runs several postgraduate therapy trainings. One is the CBT certificate, the CBT diploma, the EMDR postgraduate certificate. We also have the neuropsychology diploma, postgraduate diploma here. So it's a bit of a growing business here at the Wellington base of the Otago University of Otago. And, you know, it's a great thing because we're helping really experienced clinicians to really upskill and embellish what they do. And so I just want you to do something a little experiential to just start you off. So I want you to close your eyes and take yourself in your mind to a recent experience of something positive. So something like a yummy food that you ate, something really recent, piece of chocolate, yummy, your first strawberry as spring arrives. Just think about that yummy food. And now just think about what you see. What's the picture that you see? And then what's the sensations that you have? What do you feel in your body? And then what are the thoughts that you're having about yourself? And what are the emotions that you're having? Okay, so come back to where we are and just noticing that when you have a positive experience, all those things are registered in your body. Okay, and they are registered in your emotions, and they're registered in your visual memory, and they're registered in all these places. And then if all things go well, what happens is those experiences get processed through your whole brain into a completed memory where you now have a knowledge base that helps you to survive and thrive. So you now have a knowledge base that says, I'm happy when I eat strawberries. And so then when you see a strawberry again, you'll think, strawberry, like strawberry, and you'll have another strawberry. Your body doesn't need to hold the whole physical, emotional, sensory experience in your body in order to be able to seek out strawberries. It just needs a knowledge base saying strawberry's good. Yeah, like them. Okay. But what happens if you have a strawberry that's not nice? Okay, and it's yucky and it's gross and stuff like that, and you don't like it. Okay, then what can happen is that your body goes, oh, threat, alert, I don't like strawberries, yuck, yuck, because they've got this taste that's stuck of this rotten strawberry. Okay, and so if that memory doesn't process and your brain realizes that actually that's just one strawberry, it's not all strawberries, that was the old strawberry, it won't learn that some strawberries are nice and others aren't. So it won't get adaptive memories about strawberries. It'll just be stuck with a yucky yuck strawberry feeling in your body, okay? And so sometimes when people have disturbing life experiences, it's like the rivers in flood. It's like there's too much information and water to be, and it's overwhelming their nervous system and their memory processing system. And what we call in psychology is obviously these are the symptoms that people experience. So if we just go through, so in the EMDR therapy model, the adaptive information processing model, which underpins the whole focus of EMDR therapy, the theory is that the incapacity to process any adverse life event, like the rotten strawberry, causes all psychological problems. It's probably not true that a rotten strawberry would cause many psychological problems, but I'm just using that as an example. Okay, so this is quite a profound theory, and this is an evidence-based theory to a point, okay? And so if you think about the ACE studies that were done on thousands and thousands of people, figuring out that there is an actual causal link in research terms between adverse child events and the level of psychological and physical health problems that people have. So this is the theory that underpins EMDR therapy, and this is the basis of the protocol, okay? So what is EMDR therapy? What do we actually do? It's an 8-phase evidence-based structured process. It's a very structured process, and the point of the process is to directly facilitate or to unblock the innate body system to process all those memory fragments of the yucky strawberry that are causing the psychological problems and responses, okay? To help everything to just calm down and come through the river and process to completion so that you learn. You learn something that helps you to survive and thrive. You learn that, oh, some strawberries are nice and some strawberries aren't nice, and I'm going to avoid the ones that have the brown bits on them or the sticky, icky bits, yeah? And so that is what EMDR therapy does. It just facilitates an innate processing system. And a lot of other psychotherapies also trigger this innate adaptive information processing system to be more efficient and helpful. And so if you think about emotion regulation skills, you think about different ways of speaking to yourself, you can see how this all calms down the river so that people can process things more effectively. But the thing about EMDR therapy is that it directly focuses on processing those disturbing life events. Okay. So the other thing about EMDR therapy is that it is evidence-based. There are now enough random controlled trials to endorse EMDR therapy as a first-line psychological treatment for PTSD, depression and phobias, and many more are in that level 2, very close to being first line. So huge progress has been made with the evidence base of EMDR therapy in the world. And hopefully we're going to get a lot more research by being attached to University of Otago. We're already seeing people starting to research EMDR therapy more. So the World Health Organization since early mid-2000s has already recommended EMDR therapy as a first-line treatment for post-traumatic stress disorder. But I guarantee that very shortly lots of different organisations are going to be recommending it for other treatments because EMDR therapy has transdiagnostic benefits. And I have a long history of doing lots of contemporary psychotherapy modalities. And one of the struggles of many modalities is that even though the theory or the conceptualizations might be transdiagnostic, the treatment protocols have needed to be separate for separate diagnoses, and this creates a lot of work. With EMDR therapy, there's growing evidence that if you actually activate the adaptive processing system well, then there are generalized effects, okay? And so if you might be treating the PTSD, but you at the same time, you find that you've also treated difficulties with confidence or the depression or all sorts of things. So the research is showing that we need to do better research to really measure the positive outcomes of EMDR therapy rather than just be a disorder-specific assessment tool that we use with the outcome research. So the other thing I love about EMDR therapy is that it's very integrated with other modalities. So if you train in EMDR therapy, you can choose. You can use it as a technique that you add on to whatever else you do, or you can fully train and use it as a comprehensive psychotherapy. Okay. But what I've found has happened for me is since 2013, when I began using it, I've found that it's become an umbrella model for all my other psychotherapeutic tools, and all those other things that I've learned over the years have integrated well. It takes a bit of transition though, so it's really important to learn the new thing and understand the model well first in the first year of this training, so that you can then learn how to adapt all your old stuff into it. And then it's incredibly culturally flexible, and it's really important to us with bringing the EMDR Institute training and adapting it to the New Zealand culture and context, okay? And that means to leave space and room for tangata whenua and kaupapa Māori services to adapt and integrate and reform their EMDR therapy process. So that's a very important thing to us at the University of Otago. Then also to be able to be flexible to different populations and specialist groups. So that's a bit of the stuff that we're doing a little bit more in the second year. Okay. So how does EMDR therapy work has often been a big question in research. And during the course, we're going to learn about lots of different theoretical models that have developed to try to explain the mechanism of action in EMDR therapy. We know that it does work. We know that through functional MRIs that things are going on in the brain that change when you are doing bilateral stimulation of the brain. And these are some of the theories that we'll be looking at in models. Okay, and this is a fast-growing area looking at evidence base around the mechanisms of action that are going on. But what we do know is that when we do bilateral stimulation of the eyes, when someone's thinking about something disturbing, the amygdala, the limbic system, the emotion center of the brain calms, which seems to activate the ability to engage the default mode network that this part that holds a whole lot of that long-term knowledge that may be useful for understanding that the strawberry's rotten. Okay. Rather than someone being stuck in their central executive network and going through the same old systems and ways of dealing with the problem that they've learned in the past. It's about the brain becoming creative and being able to come up with better solutions for this current problem. So now thinking about the EMDR training. So EMDR training was first developed by the EMDR Institute in America, which was came out of Francine Shapiro, who was the founder, came out of her research program, and they set up an institute to make sure that only evidence-based EMDR therapy was taught, and that there was some boundaries around how it was developed, so that we could compare research. Okay, but but in New Zealand, there are 3 different EMDR therapy trainings, and there is an EMDR New Zealand, which is a body of EMDR practitioners, and the point is to try to keep the standard high enough and to encourage good development of EMDR in New Zealand. So they have accredited 3 trainings, and there's the institute training, there's a training by Vania Metaba, and then there's this Otago University training. So all of those trainings include lectures to teach a knowledge base and understand the model, and then face-to-face block courses where you do therapy with each other, a real life therapy. Okay, so you choose something not too disturbing, and then you process that with your partner, and they process it their own thing back. And it's really important that these therapy role plays or practices are real, because it doesn't kind of make sense or work without that. But what has been found through this is that even though sometimes that feels a bit scary and risky, we've got better and better at trying to make that a safer place for people and encourage people not to do really intense work at the program. To be responsible, that this is a training environment. What we found is the benefits of the experience has been massive in terms of your ability to do the therapy, because you know what it feels like and you know where it could go. Yeah. So we apply, once you've done those things at the beginning of the training, you actually go back into your real world clinical practice and start using it after the first block course in the first year. And then throughout the year, we have supervision, and we all have around group supervision, but also feeding back around conceptualizations, around videos of your work. And that's the stuff that is included in this course that is not included in the institute training. So why choose studying at University of Otago EMDR? Well, this is the year one group from this year. We're still in progress. They've just handed in their videos. And what we found is that actually working, unlike the institute training where people may go from block course to another block course, or it may be quite far apart, doing a whole year with a group of people, and they build networks. And we've also had the same, so in this picture, you'll see quite a few experienced EMDR practitioners as well as new students. You might recognise some people there. So here at University of Otago, we have what's called a postgraduate certificate in health sciences endorsed in EMDR therapy. Okay. And this is a 2-year qualification. And each year includes 30 hours lectures online where you learn the theory and skills and knowledge. So we do breakout groups and things where you practice things, but also we do the practical face-to-face real therapy in the block courses here in Wellington. Okay. And so twice a year you come to Wellington for 2.5 days and do this practice. And then we have the supervision that I told you about before. And that's about your real work back at home. And we have a range of clinicians involved in teaching the course, and so they come from different, working in different contexts, and so that's really helpful because you can hear and see how things can be applied into different contexts. So the year one is called the Foundational Clinical Practice in EMDR Therapy, and this is the year that also qualifies you for EMDR NZ membership because it's an accredited basic training. But it's a basic training plus, because we also have additional theory, practicum supervision and competency assessment. So you end up with a competency certificate rather than a completion certificate. And then year two, the advanced clinical practice in EMDR therapy. This is, we're following on from year one, consolidating your skills, but also we're adding a package of advanced topics, because what Tom Flewitt and I found that when we've run the institute trainings, people then go out into the world with just a basic toolkit, and it's not really enough for the context of New Zealand. It's not really enough for the severity and complications that we face on a daily basis and as mental health practitioners. So we wanted to extend the training to year two so that people actually leave with competency in how to manage dissociative disorders and how to manage huge comorbidities and how to manage big emotional dysregulation or big dissociation, and so that they can feel confidence and their employers can feel confidence that they've shown competence in those areas. So I've just put a little graph here of the difference between the EMDR Institute training and the Otago training. And I think I've actually covered that. But basically we have 10 extra hours of theory, 6 extra hours of consultation feedback, and we have the assessment of competency. And we found that the students become a supportive group for those course years and beyond. And next year we've got some graduates actually in the video at the beginning. Those people that were speaking who were students, they actually were some of our first postgraduate certificate graduates, which was the end of 2024. And they are coming back next year to share some of their expertise in some of the online lectures, just sharing case examples. And one of the people was going to share a case example about working in ACC sensitive claims and how they fill out their wellbeing plans in order to get EMDR therapy funded better. Another person's talking about working in the corrections service. So different people will contribute as they come. So this could be something in your future too. If you complete this course, then it might be something that you can bring back to help build the quality of EMDR therapy in New Zealand. So the compulsory, you do year 1 and then you do year 2 and then you get the postgraduate certificate. There is an option to also just do the advanced paper. If you've done an EMDR Institute full basic training and got the certificate, then you can apply with some extra things like you need to show a video and a case consultation, and then you can do the second year paper. We had 2 people do that last year, but then they actually decided to come back and do the first year paper second, which is a bit kind of awkward and weird. And yeah, so it's not really the right order. But that is a possibility if you just don't want to do, if you just want to do the advanced thing, but that doesn't give you a postgraduate certificate in EMDR. You need to do both papers to get that. Okay. So the cost this year, the cost is about 2,700 for the 1 year. So each year will be that much. We don't know for 2026, but the previous year was about 2,500. So I think sort of maybe. And at the moment, private trainers, if they're doing a package deal for the whole basic training, between 2,500 to 3,000. But most people do the basic training in 4 bits, and so that actually increases the cost quite a bit. So applications were open to people who, so this is a training for experienced clinicians where you've had some experience of managing therapeutic situations already. Okay. So you need 4 years postgraduate experience in the field and a minimum of postgraduate diploma in any mental health practical field, and then full registration with a professional body, and obviously experience in psychological therapy already. So yes, in summary, it's a 2-year course with the foundation of clinical practice in the first year, advanced clinical practice in the second. It's only the second university-based EMDR therapy training in the world. And we're specifically tailoring it to this New Zealand Aotearoa context. And that's a work in progress as well, because as people get trained, then they can start to contribute back into the development of the course. And they're coming from their own contexts and their applications. So if you want, you obviously know the website number, and then down the bottom is the contact for Maria to find out about registrations if you haven't already. I know there's some people that have already registered, and it's only limited numbers for year 1 and year 2. So even though it feels like a long way away, it starts in February, and January goes fast. So I encourage you, if you're interested, to just email Maria and get the process started.
I'm MaryAnn Stevens. I'm a clinical psychologist. I work in private practice in Wellington, but I'm also part of the Otago University EMDR Therapy training. Francine Shapiro discovered there was this surprising link between moving your eyes side to side and the reduction of distress about past events and other trauma-based disorders. And many guidelines across the world now approve EMDR therapy as an evidence-based treatment of choice for post-traumatic stress disorder for adults and children. We've designed this course to reflect Aotearoa New Zealand and what we need in this country. We've made it easy by packaging up all the different courses and things that people are doing that are necessary for becoming an expert EMDR practitioner. The postgraduate certificate is designed for experienced clinicians. It's designed for people who work with complex cases. You will go away from this course knowing that you're competent.
EMDR can help you to get into a very deep place of your client's problem.
Now I can see more people for less time, and I can really enhance the outcomes using the learning from this course.
Really understand where their traumas come from and the impact of that trauma.
This is what the research is now showing, one of the 2 key treatments of choice.
And ask them, would you like to try this and then see if you need medication? And that's what most people want. So when they do that, it's really amazing.
The course recognises that you are already working, you already have your commitments, and you're adding this on top. And I think there's lots of flexibility to be able to complete the course with everything else that you might need to do as well.
This is a tool that works far better than most other things that I've known.
Practitioners who've done this training before have said that even though they have a lot of expertise, even though they've trained in a lot of different modalities, this adds new value. This adds something different.
We are really pleased to be offering the only university-based EMDR course in Australasia. This course is really popular, so please email us as early as possible if you are interested in either the advanced or the basic training. We look forward to having you study with us.
The best part is to discharge people. They are happy, they are well, discharge them well.
I would absolutely recommend it.